Our government says more and more South Africans are not adhering to COVID-19 regulations. This includes hand washing and the proper wearing of masks. Now, can technology be used to play a more effective role in informing government strategies? Well, joining us tonight to discuss this further is Vuyani Jarana, who is the CEO of tech company Mobax. Good evening, Mr. Jarana. Thank you so much for your time. Interesting, because when you analyze the response of government so far to COVID-19, you say that it seems to be lacking some strategy and also not being comprehensive enough. Speak to us a little bit more about that.
Yeah, I think firstly, Cathy, I think we must commend government for their response to COVID. I think it's quite strong in terms of managing the lockdown, in terms of the clinical side of the intervention. It looks quite good, actually. Where we think more could be done is around using digital technologies to really manage the spread patterns. So to do that, you need large-scale telco data with some of the platforms with big data analytics and artificial intelligence to be able to track where, if, for example, if I can put it in simple terms, if I test positive today, the COVID tester must be able to go and track where I was last week and be able to understand and pick up from the data that I was with some people, these have been exposed to me, I may have been positive already by that time. Then using technology. So that's the I think if you look at countries like South Korea and Taiwan, they use this digital technology and telco data effectively. I think that's what I think should be done better in terms of the current intervention.
At the onset of this virus, especially when South Africa introduced its own responses for tracking and tracing and the screening, we were told that government will be working hand in hand with mobile operators to try and be able to gather this data. As far as you can see, as somebody who's in the field, do you think that perhaps that information is not being used efficiently enough, or that it could be expanded further?
I think more work is being done in that area. I think a lot more opt-in kind of interventions might be used currently. Also, some apps as well as Bluetooth interventions. The truth is this: more and more devices don't have smartphones in the continent. They also don't have Bluetooth capability. So to use large-scale telco data will give government the ability to look at the spread patterns and patterns of exposure and begin to target the people who have been exposed. I want to know if I've been exposed to a person who tested positive so that I can take the proactive action and not continue to be more available in public when I could actually be staying at home until I know that I'm negative in testing. So large-scale telco data, big data, analytics platform, AI, where we can even allocate COVID risk score to an individual level. I think countries like in Asia have done a reasonable good job. I mean, there's no crystal ball. I think on top of what government is doing, don't get me wrong, government is doing a great job. I think we can step up the technology, the use of technology a little bit, and we might see better results.
Sure. You're using South Korea and Taiwan as some of the case studies, and I'm just thinking, in terms of the infrastructure comparatively, do we have the same kind of infrastructure that would enable the collection of such data?
Yeah, Asia Pacific carries the same profile in terms of the demographics as Africa. The mobile penetration is very different from Europe. Europe has got penetration of smartphones very, very deep. Asia is like us. If you talk about Philippines, you talk about Taiwan, and to a greater extent, South Korea itself has the same demographic profile in terms of penetration of technology as countries in the continent. I don't think we are lagging behind as South Africa in this regard. We can step up and be able to leverage that technology at scale.
One of the things that you're also pushing for is perhaps a shift that sees digital technology as a luxury more than a necessity.
Absolutely. I think for the longest period of time, when you look at digital technology, it was kind of the portfolio for the elite, the people who are early adopters. I think what COVID-19 has shown us is that it's a necessity. We need to bridge the gap between the children who are coming from rich families in suburbs and bridge them with those that are coming from Limpopo, in the Eastern Cape, in the rural areas, so that they can access the same quality education. So COVID-19 has shown us the inequalities and the digital divide. I think we have to make a concerted effort to actually make the bridge the digital divide in order to make sure that in the future, never again shall technology be the determinant of those who will continue going to school versus those who won't.
Does the implementation of what you're saying also require then a change in policy or more progressive policy than what we have right now?
I think the good thing is that the Department of Communication and Digital Technologies has set the path in this direction. I think the choices of focusing on fourth industrial revolution policy is being reviewed. The enablement of the sector is top of the agenda of the minister as far as I know. So the policy framework is being put in place, but the posture of government is positive towards driving the digital technologies. What is important are investment models, because to actually build digital infrastructure, you need capital, and of course we need patient capital that is going to make sure that these services don't be unaffordable to the ordinary citizens of the country. So policy framework is good. Investment models which will provide patient capital become critical, and then the ability to deliver infrastructure at scale is what's going to make us catch up a little bit to make sure that we trade ourselves out of the corner.
Sure. If one looks at the situation that we're in right now, and, you know, we take what you're saying in terms of the role that technology could be playing, the bigger role that technology could be playing, how easy is it to implement part of what you're saying? Is it something that, you know, government can wake up tomorrow and do?
In terms of the COVID intervention using digital technologies, Cathy, it's a matter of 2 or 3 weeks kind of deployment of software as a service and firing up a few machines, whether they are in CSIR or elsewhere. And then telcos get mandated to provide large-scale telco data, and then we inject clinical data from COVID testing to be able to give us patterns of exposure as well as mobility of the citizens who are affected, and then that can complement government's efforts. So that part is a lot more easy to implement. The more complex one is really building infrastructure into townships, into rural areas, to make sure that we bridge the digital divide. It needs policy review around way leaves. It needs investment in terms of patient capital. It needs ability to execute in terms of project management and technology implementation. So that's more medium, longer term. But the COVID intervention, it's something is in hand. I think it can be implemented quite fast.
All right. Vuyani Jarana is the CEO of tech company Mobax. Thanks for your